Good evening all. Today our class is about erythropoiesis. See, in the erythropoiesis, we will divide this erythropoiesis into two parts because in this topic we are having chance of getting two types of questions. First one is site of erythropoiesis. Site of erythropoiesis along with process of erythropoiesis and stages of erythropoiesis. Sites of erythropoiesis, process of erythropoiesis along with stages of erythropoiesis. This is for one question, one 5 marks question, and the next factors necessary for erythropoiesis or factors required for erythropoiesis. This is for one 5 marks question. So we have divided this topic into two classes. These three concepts belongs to the first class and this one is to the second class. Now coming to the concept of this first class topic, site of erythropoiesis. First one is site of erythropoiesis. See, this site of erythropoiesis, see, observe how I am explaining to you, because this try to apply this pattern in the examination. So there will be chance of getting more marks and getting some impression from this examiner or lecture professor who is correcting our paper. Okay, try to apply this process how I am explaining. Site of erythropoiesis. Site of erythropoiesis. This site of erythropoiesis takes place in, site of erythropoiesis in fetal stage, in fetal life or intrauterine life, in newborn babies or children or adult, newborn baby or children or adult. Okay, next, these are the two concepts that from the site of erythropoiesis. In the fetal stage, first one is mesoblastic stage, second one is hepatic stage, and third one is myeloid stage. Mesoblastic stage, hepatic stage, myeloid stage. In the mesoblastic stage belongs to first 2 months of intrauterine life. Okay, here the site of erythropoiesis takes place at mesenchyma of yolk sac. In the hepatic stage takes place at third month of intrauterine life. Okay, at this hepatic stage, the site of erythropoiesis takes place at liver, spleen, and lymphoid organs. Next, in the myeloid stage takes place at last 3 months of intrauterine life. This myeloid stage takes place at, the site of erythropoiesis at myeloid stage is at bone marrow and liver. Next, coming to these newborn babies, children or adults. Here the site of erythropoiesis takes place at bone marrow. Here the site of erythropoiesis takes place completely at bone marrow, but of course in the bone marrow, but it depends upon the age of that person. If the age of that person is below 20 years, the bone marrow, the site of erythropoiesis of bone marrow takes place in all long bones and flat bones. If the age of the person is greater than 20 years, the site of erythropoiesis takes place at bone marrow in membranous bones like vertebral column, sternum, ribs, scapula, iliac bone, skull bones, and the ends of the long bones. Okay, I hope you understood the process how I am saying. Next, this is about the site of erythropoiesis. Now coming to the next concept, process of erythropoiesis. See, in the erythropoiesis starts at the erythropoiesis starts with stem cells. That means hematopoietic stem cells. Hematopoietic stem cells. Hematopoietic stem cells. Hematopoietic means primitive cells. Hematopoietic means primitive. Primitive means పూర్వకాలం. హెమటోపాయిటిక్ మీన్స్ పూర్వకాలంలో తయారైన సెల్స్, అంటే పూర్వకాలంలో బ్లడ్ అనేది డివైడ్ కాకముందు తయారైన సెల్స్. దట్ మీన్స్ these hematopoietic stem cells, first it doesn't decide to prepare that means ఒక స్టెమ్ సెల్ అనేది ఏ సెల్ కింద ఫామ్ అవ్వాలో ఎప్పుడు అది ఫిక్స్ కాదు. అంటే దట్ మీన్స్ ఒకవేళ ఆర్బీసీ కింద ఫామ్ అవ్వాలా, డబ్ల్యూబీసీ కింద ఫామ్ అవ్వాలా, ప్లేట్లెట్స్ కింద ఫామ్ అవ్వాలా అనేది ఏ స్టెమ్ సెల్ కూడా అది పుట్టగానే డిసైడ్ చేసుకోదు. సో ఫస్ట్ పుట్టగానే వచ్చే ప్రిమిటివ్ సెల్ ఏంటి అంటే uncommitted pluripotent hemopoietic stem cell. Uncommitted pluripotent hemopoietic stem cells. From these stem cells committed to a particular cell. అంటే ఒక స్టెమ్ సెల్ అనేది ఒక పర్టికులర్ సెల్ ని ఫామ్ అవడానికి అది కమిట్ చేసుకుంటుంది. దట్ మీన్స్ ఆర్బీసీ అవ్వచ్చు, లేదంటే డబ్ల్యూబీసీ అవ్వచ్చు, లేదంటే ప్లేట్లెట్స్ అవ్వచ్చు. నెక్స్ట్ these committed pluripotent hemopoietic stem cells gives two types of cells, lymphoid stem cells and colony forming blastocyte. Lymphoid stem cells and colony forming blastocytes. These lymphoid stem cells gives lymphocytes. These lymphoid stem cells gives lymphocytes, and these colony forming blastocytes again forms three colonies. First one is colony forming unit erythrocyte. Second one is colony forming unit next one is colony forming granulocytes or monocytes. Colony forming granulocytes or monocytes. Next one is colony forming megakaryocytes. Colony forming erythrocytes, colony forming granulocytes or monocytes, colony forming megakaryocytes. These colony forming erythrocyte gives RBC. Colony forming erythrocyte gives RBC. This is the concept that we are going to study in this chapter. Next, this colony forming unit granulocytes or monocytes gives granulocytes. Okay, from the these colony forming granulocytes gives neutrophils, basophils and eosinophils. These colony forming monocytes gives monocytes. This colony forming monocyte gives monocytes, and this colony forming megakaryocyte gives platelets. Okay, this colony forming megakaryocyte gives platelets. This is the concept of process of erythropoiesis. Next, coming to the stages of erythropoiesis. Before coming to the stages of erythropoiesis, while undergoing this process of erythropoiesis, some changes occurs from starting stage to the ending stage. In that, the changes occurs in this erythropoiesis is reduction in size. Size reduces from starting to the ending. Next, disappearance of nuclei or nucleolus. Next, appearance of hemoglobin appear avutadi. Next, change in staining properties of cytoplasm. Next, we will discuss about what are the stages of erythropoiesis. This is most important and frequently asked question, stages of erythropoiesis. In that, the first stage is pro-erythroblastic stage. First stage is stages of erythropoiesis. The first stages of erythropoiesis. The first stage is pro-erythroblastic stage. First stage is pro-erythroblastic stage. In this stage, the nuclei is 20 micrometers in diameter and it contains two or more nuclei. Okay, and it having chromatin network. Two or more nuclei and having chromatin network. And the staining properties of this stage is basophilic. Next, the important events that occurs in this Proerythroblastic stage is synthesis of hemoglobin starts. Only synthesis of hemoglobin starts. Next stage is early normoblastic stage. Its size is 15 micrometers, and in this stage no nuclei is absent. No nucleus present. Nucleus is absent, but this chromatin is condensed. That means dense chromatin network forms. Dense chromatin network forms, and its staining property is basophilic. And the important event in this stage is the disappearance of nucleus takes place in this stage. Early normoblast stage, disappearance of nucleus takes place. This is the second stage. And now coming to the third stage. Third stage is intermediate normoblastic stage. Its size is 10 to 12 micrometers in diameter. Next, in this stage, the nucleus is disappeared and further condensation of chromatin network takes place. Condensation of chromatin network takes place, and it is polychromatic staining property. Staining property is polychromatic. As well as in this stage, the main event occurs in this stage is appearance of hemoglobin takes place. Appearance of hemoglobin takes place. Synthesis of hemoglobin takes place at proerythroblastic stage, and appearance of hemoglobin takes place at this intermediate normoblastic stage. Next stage is late normoblastic stage. Next stage is late normoblastic stage. Its size is 8 to 10 micrometers diameter, and here the condensation of chromatin, there is a small sized condensation of chromatin takes place. That means ink spot nucleus. We call it as ink spot nucleus. That means think that if it is the white paper and there is only one ink spot in that white paper, so when compared to this white paper, it is very small. And even when compared to the RBC, this nucleus in this late normoblastic stage is very small. So we call it as ink spot nucleus. That means like this. Next, its basics, that means its staining property is acidophilic, and the main event that takes place in this late normoblast is nucleus completely disappears by pycnosis. Pycnosis means irreversible. That means oka process జరిగింది irreversible అయితే దాన్ని పిక్నోసిస్ అంటాం. దట్ మీన్స్ న్యూక్లియర్ ఒకసారి డిసపియర్ అయిపోయిన తర్వాత సెల్లలో మళ్ళీ అది ఎపియర్ అవ్వదు. సో దిస్ ప్రాసెస్ ఈస్ పిక్నోసిస్. దట్ మీన్స్ irreversible. Okay. Next, the fifth stage. The fifth stage is reticulocytic stage. The fifth stage is reticulocytic stage, and here the size of it is 7 to 7.5 micrometers in diameter, and here the nucleus is completely absent. That means in this stage, in the fifth stage as well as in the sixth stage, the nucleus completely disappeared, and the staining property of this stage is basophilic, and the important event that takes place in this stage is reticulum is formed, and here the cell enters capillary from site of production. If this is the site of production of RBC, this cell enters into the capillary. This is the reticulum, and this cell enters into this capillary. Okay, here this is the process that occurs in this reticulocytic stage, and the last stage is matured RBC stage. The complete size, the perfect size of the RBC is 7.2 micrometers in diameter, as well as here the nucleus is completely absent, and the staining property of it is acidophilic. As sometimes the RBC helps in the defense mechanism to kill some microorganisms, its staining property is acidophilic, and the important event that takes place in matured RBC is reticulum disappears, and this cell attains biconcave shape. Reticulum disappears and the cell attains biconcave shape, and the RBC is ready to circulate in the body. The RBC is ready to circulate in the body at this stage, matured RBC stage. Thank you all. We will meet tomorrow with these factors affecting the erythropoiesis, factors required for erythropoiesis. That is very important for 5 marks as well as in the essay answer also. Most frequently asked question. Thank you all.